Hello, my name is Morgan Lamb, and I am a student at Bryant and Stratton College pursuing an associate's degree in the Medical Reimbursement and Coding program. I would like to discuss some of the course and institutional outcomes that I have met thus far that are designed to prepare me for the knowledge, competencies, and skills necessary to make the transition from student to certified medical coder. Through course-specific projects, I will demonstrate how these outcomes have been met. In the program's Electronic Health Records course, we were asked to take on the role of a hospital's privacy and security officer and implement a corrective action review presentation for individuals who were non-compliant with the laws and regulations enforced by HIPAA, a legislation that protects the privacy and security of patients' health information. As part of this review, the direct violation was identified, the appropriate corrective action was implemented, HIPAA privacy and security rules were reviewed, as well as possible legal consequences and risks for the individual, as well as the hospital, and preventative measures were discussed to resolve any possibility of a reoccurrence in the specific violation. Lastly, interactive scenarios were completed through role play to further educate individuals in the prevention of privacy and security violations. Course outcomes met were through description of the privacy and security issues involved with the electronic health information and the release of information. The explanation of legal consequences was demonstrated with risks associated with the improper exchange of patient information and electronic health records. Institutional outcomes were met through thinking abilities that employ strategies for reflection and learning, as well as practice, in order to adjust to the learning processes for continual improvement. In the program's ICD diagnostic course, we were asked to place ourselves in the role of a hospital's coding supervisor and oversee the transition of cross-training medical coders and inpatient as well as outpatient coding using ICD-10-CM to create a more effective workplace environment by reducing the common issues of medical coder availability and coding errors due to the lack of education and experience. This was implemented through the creation of a training seminar on the difference between inpatient and outpatient healthcare facilities, with information to be extracted and translated into accurate and valid code, complications that arise in both inpatient and outpatient coding, as well as a final comparison of the two forms of coding. Course outcomes were met through accurately assigning and sequencing ICD-10-CM diagnostic codes for inpatient and outpatient as well as physician services according to the official coding guidelines, as well as employed both manual and electronic resources to accurately code and sequence information from patient health records using the ICD-10-CM classification system. Institutional outcomes were met through information literacy and communication by utilizing appropriate current technology and resources to locate and evaluate information needed to accomplish a goal, and then communicate findings in visual, written, or oral formats. Through completion of this course and institutional outcomes, I am working towards my professional goal of an anticipated graduation date of April 2020 and medical coder certification to follow. This will enable me to gain employment in a healthcare facility that specializes in both inpatient and outpatient care that provides the opportunity for personal and professional growth so that I may become a positive and contributing force in the healthcare industry. Once again, my name is Morgan Lamb, and thank you for your time and consideration.